We went, as you would all know, from 48 cases 1 week ago to 86 cases now, with 3 districts being of primary interest, Corozal, Oranjewak, and Belize, and in the Belize district, primarily the town of San Pedro. We have 53 active cases now, and 2 of those are hospitalized, 1 in Oranjewak and 1 in Corozal. From the 14 cases, I know yesterday when we were leaving, we said 12. We did manage to confirm a total of 14 cases when the final lab process went through. The breakdown is as follows. Out of the 14 cases, 1 person is linked to the hospitalized case at the Northern Regional Hospital. That is an active cluster in the village of Santa Marta. The person identified lives in Belmopan. There are 2 persons linked to the case identified in San Pedro on Tuesday. This is a second cluster which is not related to the initial case we had identified on Sunday. So we are talking about cluster number 2, if you will, in San Pedro. We found 2 other cases. And this is tied to a church in San Pedro for which contact tracing started earlier in the week, and we anticipate further samples to be processed later on today. 10 cases are linked to the case identified in San Pedro on Sunday. Some samples are still pending, and those are coming out in the next couple of minutes, if you will. And 1 other case in San Pedro that is not linked to the 2 active clusters in San Pedro. So contact tracing for this other case is ongoing. So based on the above, the epidemiology unit is able to now confirm that there is community transmission in the town of San Pedro. And for now, other than the cluster we are looking for in Sunday, we are also following an active cluster for those that are related to the church, a specific church in San Pedro, where we had been told approximately between 20 to 30 persons could be having signs and symptoms.